How to cope with trauma. Traumatic stress is a natural reaction to a traumatic incident. Symptoms usually improve with time, but persons with more severe symptoms may require expert assistance. Hi and welcome to Mind Stretcher. On this channel, I cover a wide range of topics related to psychology and mental health, from the importance of self-care to the benefits of mindfulness and meditation. I offer practical tips and advice for improving your mental health in your everyday life. Join me as we learn more about how to cope with traumatic stress. It is typical to be exposed to a traumatic experience during one's lifetime, whether it be a violent act, a catastrophic injury, a sexual violation, or another stunning occurrence. Many people will undergo severe stress as a result of this unusual incident. Even seeing a highly unpleasant occurrence or having a close family member or friend suffer such an event can cause severe stress. It is usual for people to experience a whirlwind of unanticipated emotions and physical symptoms in the days and weeks following such a catastrophe. They are as follows: sadness, feeling uneasy, jumpy, or hypervigilant, sleeping problems due to irritability or wrath, relationship issues, unwanted thoughts, flashbacks, or nightmares, having difficulty sensing good feelings, avoiding people, places, memories, or thoughts that are linked to the painful event. These symptoms usually improve with time. However, for some people, more severe symptoms persist or interfere with their everyday lives and may not resolve on their own. In the month following a traumatic experience, some persons may develop acute stress disorder, characterized by high-stress symptoms that significantly interfere with everyday life, education, job, or social functioning. Others may develop post-traumatic stress disorder (PTSD), characterized by symptoms that interfere with everyday living and linger for longer than a month following the incident. Coping with traumatic stress. The good news is that there are extremely effective methods for dealing with and treating the stressful consequences of trauma. Psychologists and other experts have discovered that the following acts can be beneficial. Lean on your family and friends. Identify friends or family members who can offer assistance. If you are ready to talk about the terrible occurrence, you might tell them about your experience and feelings. To reduce some of your everyday stress, you can also ask loved ones to assist you with domestic activities or other commitments. Face your emotions. It's natural to desire to avoid recalling an unpleasant occurrence. However, not leaving the house, sleeping all the time, isolating oneself from loved ones, and abusing substances to avoid reminders are not long-term coping strategies. While some avoidance is good, excessive avoidance might prolong your stress and prevent you from recovering. Try to get back into a normal schedule gradually. Support from loved ones or a mental health professional may be quite beneficial as you get back into the swing of things. Make self-care a priority. Eat nutritious foods, engage in regular physical activity, and obtain a decent night's sleep. Also, look for healthy coping skills like art, music, meditation, relaxation, and spending time in nature. Please be patient. Remember that having a strong reaction to a frightening experience is natural. As you heal, take things one day at a time. Your symptoms should progressively improve over the next several days. When should you seek help? Not everyone requires traumatic stress therapy. The majority of people heal on their own over time. However, mental health specialists such as psychologists may assist you in developing good coping strategies in the aftermath of a traumatic experience. You may have acute stress disorder or PTSD if your suffering is interfering with your relationships, employment, or daily functioning. Treatments for post-traumatic stress disorder. Psychologists can help you cope with traumatic stress or acute stress disorder by providing evidence-based therapies. One example is psychological first aid (PFA), which was originally developed to assist children, adolescents, adults, and families in the aftermath of a tragedy or terrorist attack. It is currently utilized to assist those who have suffered from any form of trauma. PFA is founded on the assumption that discomfort is natural following a traumatic incident. Rather than treating stress as a condition, this approach focuses on providing support and help, as well as sharing knowledge about stress reactions and coping skills. PFA is provided by mental health experts and disaster response personnel in a variety of venues, including hospitals, housing shelters, community settings, and even through telephone crisis hotlines in the days and weeks following a trauma. Cognitive behavioral therapy, or CBT, is another evidence-based treatment that has been used successfully to treat a variety of psychiatric illnesses, including traumatic stress. CBT is a psychiatric treatment that teaches people how to transform unwanted thoughts and behaviors. The World Health Organization recommends trauma-focused CBT for people suffering from acute traumatic stress. According to some studies, those who get trauma-focused CBT may be less likely to acquire persistent PTSD. Furthermore, a number of therapies have been created to assist children and adolescents who have experienced trauma or unfavorable childhood experiences such as neglect or abuse. Many of these therapies are family-based, with the child's parents or carers participating in the therapy process. A psychologist can assist you or a loved one in recovering from a traumatic situation. Thanks for watching. We hope you found this video helpful in understanding more about psychology and mental health. Remember, it's always important to take care of your mental health and seek support if you need it. If you enjoyed this video, don't forget to like, comment, and subscribe to our channel for more content on psychology and mental health. Take care and have a great day.